reading the paper together. The title of this paper is Remote Ischemic Conditioning Delays Dementia. Hello everyone. Today we're going to discuss a special health study called Remote Ischemic Conditioning, abbreviated as RIC. It sounds technical, but it's actually a simple and safe method that may help keep our brains sharp and even slow down the effects of dementia. What is remote ischemic conditioning? Imagine wrapping a blood pressure cuff around your arm or leg. You inflate the cuff to a high pressure to temporarily block blood flow for about 5 minutes. Then you deflate the cuff to restore blood flow and rest for 5 minutes. Repeating this block and release cycle 3 to 5 times completes one RIC session. In short, it's a brief interruption of blood flow followed by restoration, which triggers protective responses in the body that benefit the heart, muscles, and even the brain. Why study RIC? As we age, our memory, focus, and thinking speed gradually decline. Chronic conditions like high blood pressure, diabetes, obesity, and high cholesterol can damage brain blood vessels, increasing the risk of stroke and dementia. Exercise protects the brain, but some people can't do much physical activity due to health issues. The advantage of RIC is that it requires no sweating or running, can be done at home, and is safe. How was the research conducted? This systematic review analyzed 14 randomized controlled trials involving a total of 772 adults. The studies were categorized into 3 types. Single RIC, done once, usually before surgery. Short-term RIC, performed continuously for several days up to a week. Long-term RIC, done daily for 3 months or more, sometimes up to 6 months or a year. Research findings. 1. Single-session RIC. Performing one RIC session before surgery has been found in some studies to improve patients' memory test results a few days after surgery. However, this effect lasts only a few days and disappears after 1 week. Conclusion: a single RIC session provides only a temporary benefit and does not lead to long-term cognitive improvement. Short-term RIC, 1 to 7 days. Some studies show no significant difference with short-term RIC. However, other research indicates that doing RIC for 1 week results in better cognitive test scores 3 to 6 months later compared to those who did not do it. Conclusion: short-term RIC has inconsistent effects but shows potential. Long-term RIC, 3 months to 1 year. Most studies demonstrate that long-term RIC can improve memory, attention, and executive functions. The effects are especially noticeable in older adults, people with mild dementia, or those recovering from stroke. Additionally, some research suggests that long-term RIC can reduce brain white matter lesions and lower the risk of recurrent stroke. Conclusion: long-term RIC is the most promising approach for supporting brain health. Safety and limitations. RIC is non-invasive and only requires a blood pressure cuff. It is generally safe for most people, with few side effects. However, study results vary because different research uses different RIC protocols. Some apply 200 millimeters of mercury pressure. Some do it once daily, others twice daily. Some use one arm, others both arms simultaneously. Therefore, more large-scale studies are needed to determine the optimal method. Key points for the general public. What is RIC? It involves using a blood pressure cuff on the arm to cycle between 5 minutes of blood flow restriction and 5 minutes of relaxation. What are the benefits? It may help improve memory and attention, delay dementia, and reduce cognitive decline after stroke. How often should it be done for effectiveness? Single session. Effects last only a few days. Short-term. Effects are inconsistent. Long-term. Most promising, especially for elderly individuals or those with cerebrovascular issues. In summary, the cardiac preconditioning, RIC, is a simple, affordable, and at-home healthcare method. Although more research is needed, it has the potential to become a new tool for brain health maintenance in the future. If you or your family members are at risk of stroke or mild dementia, this is a promising new direction to consider. Does everyone understand this paper? Does everyone like it? Do you believe in the effectiveness of RIC? Would you like to try RIC and take care of your health? Hurry and scan the QR code to order an RIC sphygmomanometer. Remember to scan the QR code to place your order. Thank you all for watching. I am Dr. Andrew Shu Lee. See you next time.